Oh, hello YouTube. You know when you see me with a bloody mouth and a swollen lip, what I've had done is another surgery. So, it's been over a year since my gingivectomy, and my gums have healed up. I know I look really gross, but if you don't like blood, don't watch this, please. Anyway, I just had a bone augmentation done, and just so you know, I have not had any pre-surgery medication. I am fully aware of what I'm talking about. Last time I was going on and on about mashed potatoes and such, and you know, it's kind of funny to watch because I was out of my mind, but I'm clear and here now. So, I won't blabber on too much. I was in surgery for an hour and a half, and it was probably the same as far as pain as the gingivectomy. It was like kind of the same thing. You know, you get in there and then they stick swabs in your mouth to kind of numb you, and then they stick the syringes in your mouth to give you the real numbing, which is probably the most pain that you'll feel. And it made my eyes water, I won't lie. And, you know, it was kind of gross. It was really gross. They opened up my, here it is. That's where I had it. I'm preparing for an implant. See, my teeth are really strange, like me. And, my roots do like this. The jawbone would be here above the teeth, you know, it would be up here. For an implant to be done, you have to put the screw into the jawbone, but my roots are in the way. So they're going to put some bone in this area here, and then they're going to put the mini implant into that. So we're preparing for that. Anyway, so what I had today was the bone augmentation, which was putting the material in here to prepare for the implant. I will have the implant 5 months after this surgery. This is my second surgery. Okay, so what they did is they swab you, numb you, shoot you up with juice, as they call it, the juice. And then they peeled away my gum line. They moved down into my bone. They made a dent in it, like a cup. They put the bone in there. They put some material on top to seal it. And then they put my gums back together and sewed them up. You want a close up? If you don't. Okay. And there's some stitches on the other side of that tooth there. My mouth is really swollen and sore, so it's hard for me to show you. But that's what it is. Okay, you can look now if you turn away. So, I have a retainer that has a tooth on it that I wear until I have my implant. And so, that is how the surgery went. That was the procedure. It was kind of nasty. I felt no pain during the surgery, of course, because you're numb. The needles hurt. And I felt scraping of my bones. I mean, if you want to grind your teeth together, it just doesn't compare. I don't know how to describe it, but it's one of the nastiest, creepy, crawly feelings ever to have your bones scraped on. But I'm alive. It's over with. And you could say, thank goodness, at least it's over with. Which is true. But now I've got to deal with the healing. And the healing takes a while, so. Last time I had my gingivectomy, I went to work the next day. I don't have to work until like 3 days from now, so I have plenty of time to heal, which is good. So, if you are going to have a bone augmentation or a gingivectomy, feel free to ask me comments on my video, and I will try to give you the best answers that I can about it. So, I hope that I look better tomorrow, and that I'm not as swole. And I hope I stop bleeding. That is one thing. I didn't bleed much after the gingivectomy. This stuff is running. I've been running blood for a while now. I got to keep dabbing it and stuff. Yeah. And I don't know why it's getting all over that tooth. Oh well. You would think for paying over $9,000 or more that my mouth would look better, but things that you have to do. Good morning. Ooh, I feel like I've been hitting the head with a hammer. At least I don't look too bad. Not like after my first surgery. So this is the morning after surgery, and I got my retainer in, so I have a tooth. My gums are really swollen around the area where I had surgery, and my stitches are sick looking. They look like spider tattoos on my gums, and I don't know if, I think I can show you. Anyway, so as far as food I got oatmeal cookie pie, oatmeal cream pie, Debbie cake things, pudding, applesauce, and jello. I've eaten mashed potatoes as usual. Mashed potatoes and gravy. And I ate those the day of surgery. Not supposed to put food on the side of the mouth that you had surgery on. So I try to chew with the other side, or what I do is I know this is improper, but you turn the spoon upside down, scrape it on your tongue, and then you put the food at the back of your mouth with your tongue. So, okay, mouth. That is stitches. Oh. And there's stitches here. Other than the headache, I don't feel too bad. I've had my retainer out pretty much all day yesterday, and I never take it out. I've been wearing it ever since I got it for like a year and a half. I've never really taken it out except to brush my teeth. So it's kind of weird, and I feel kind of paranoid that my teeth are going to move, especially with the new bone. And when I put my retainer in this morning, it felt kind of sore, and the arches on it are rubbing into my stitches, so it's not very comfortable. But I'd rather my teeth not move, so I've been wearing it this morning, and I think that might be what's giving me a headache. My stitching's kind of sore too. Kind of hurts. But I'm not in extreme pain. I mean, the only thing I've been taking is Tylenol, extra-strength Tylenol liquid. That's all I took for my last surgery. I don't take Lortab. They make me sick. And I don't need it. I can dig it. So I'm digging it, and I'm watching Hulu. And really I could go out and do stuff, but not with this headache, and I'm probably going to take some Tylenol in a little bit. But doing good. Healing fast. Feeling great.